Let me pick up from what the minister just said about issues that he believes will make an impact in the public health system, but issues to me which look like or sound like are things that we should take for granted: having beds in hospitals, having mattresses, having clean linen. I don't know what you thought.
Good afternoon, View. Thank you for inviting me. You're absolutely correct. It's astonishing that routine matters are raised to the level of having a major press conference to say, well, we have to buy linen and we have to make sure we have enough beds and, the most elementary things, as though it's a sudden revelation arising from a reviews of hospitals. Recently, one conducted by the Health Ombudsman seems to be one of the catalysts for this unimaginable realization that actually we need to supply our hospitals and our facilities with these amenities, which are budgeted for. And so it is truly astonishing. But I'll say this much, and this is the way to approach this. The Ombudsman's report on Helen Joseph Hospital that came out about a month ago is a replica of the former Ombudsman's report on Rahima Musa Hospital, a couple of kilometers down the road. An exact replica, outlining the same thing that came out years ago, and numerous others. And so this minister sits here and tells the country, well, we've worked this out and we'll get 1.4 million items now purchased. What he doesn't say is why that was not done routinely in the first place. And second, how is this going to be done? If it's going to be done through the same corrupted tender system that provinces use, I can assure you the money will run out before you even know it to purchase these things, because that's what routinely happens. I'm pleased that they found money to employ the doctors. The public service needs those doctors. It's not that the doctors need jobs. I heard in his press conference, well, we have high unemployment and they can't complain. That's utter nonsense. We train doctors to meet the demands of the public service. The public service has the demand for these doctors. What's happened to the supply? What's happened to the money that was given to the provinces to fund the employment of these doctors? They never speak about that. It's almost as though everything is de novo, that they haven't been here for the last 30 years, that the idea of equality in access to healthcare wasn't a feature of our 1996 constitution, as though this is a new revelation. We must stop they have to stop the gaslighting at some point, and the sooner the better.
What for you, Dr. Dasoo, should be the issues that the minister and his MSCs, what are the issues that they should be preoccupied with beyond beds, mattresses, and linen? Those issues that would make a huge difference and would turn things around for our public health system.
Yes, I think this is a very important question, and thank you for asking it. You see, they continue in their current roles, where all authority rests with the MEC, who is a politician, which is really a constitutional problem that the civil service should be handling, such as appointment of staff, such as deployment of staff. These are not the functions of an MEC. They have, however, inveigled themselves into that and aggregated to themselves the control of budgets. So they'll decide which posts need to be funded, which shouldn't. They'll decide who to parachute in as a CEO, who has only accountability to them, not to the local hospital community. They have taken away all authority from optimizing the health platforms that this professional staff are trained for years and years to actually best perform. So they've done that. And this is a question of governance. So if they've got to do one thing, if the national government has to do one thing, is to consider this, that it has to alter fundamentally the system of governance of provinces. It's not a question of, okay, maybe we need to get more efficient procurement of linen or make sure that the medicine stocks are in and that's how these things, or get more beds, that's how these things will resolve. We are never going to resolve this if you don't change this corrupt system of governance that permeates provincial health systems. It's a fact. Here he's speaking about something of the order of 2.2 billion to fund the doctors and to purchase these things. In one hospital alone, Tembisa Hospital, 3 billion was purloined. It was sucked out by various crooks. 3 billion rand. He says nothing about that. There still haven't been consequences for that. Babita Deokaran was killed for that. So, you know, when I listen to this, it's with a sense of great dispiritedness. There's no grasp of what is really important here in our health system. It's all a cover-up. It's all about gaslighting. It's all about saying, look how wonderful we are. We have determined that we want equality in healthcare. It's what the first health policy produced and demanded, and which they stopped in 2007 and gave us this NHI, uncosted, unresearched, and they spent the last 15 years retrofitting into this act, which will take another 15 years before it's implemented. And that's how they deflect attention, talking to people, oh, it's a terrible thing. The rich are the only people who object to NHI. We object to NHI. We who believe in the public health service, we who were in the struggle and who developed the first post-apartheid health policy, we believe in the public service. We are not the ones that he's talking about. But he won't refer to us. And we have given the way forward, which he has refused to listen to. He refuses because saying it's sub judice. We're not sure what our proposal, what's sub judice about our proposals to the president and to him are. We are not in litigation. He is in litigation with his fantasy called NHI. That's his problem. But the country doesn't move forward. We'll get more linen, I'm pleased to say, and we'll get more doctors, I'm also pleased to say. That will reduce the pressure on those who are carrying an incredible burden. Health workers carrying the incredible burden. But the bigger part of their burden is the atrocious management that emanates from provincial governments.
Dr. Dasoo, you touched on exactly what was going to be my last question, because no interview, no briefing ever ends without us touching on the issue of the NHI, and you went straight there. And I must thank you for your time and insights. Progressive Health Forum convener, Dr. Aslam Dasoo.